Quality improvement is a hot topic in all areas of healthcare, primary care being no exception. Starting with Medicare and Medicaid, many insurance companies are looking for ways to improve primary care. The healthcare providers on the front lines also would like to improve the care they provide, along with decreasing the cost for providing this care. Priority Health, along with Blue Cross and Blue Shield of Michigan, have partnered with Medicare and Medicaid to test out a plan known as Comprehensive Primary Care Plus. The plan is being launched to follow the ending of a 5-year pilot that was started to move CMS towards a value-based system that would reduce unnecessary care. The original pilot resulted in a $325 million savings. Comprehensive Primary Care Plus would further push healthcare towards a value-based payment system. Savings generated by this plan would come from improving the primary care patients receive. The push towards a value-based system represents a large change in the healthcare industry for providers and their staff. Goshi and Davis provide strategies for facilitating change and working with resistors to get them on board, and lastly, they provide change-promoting strategies. When wanting to bring a major change, it is suggested that you start with a new advocacy paradigm. This suggests that advocates of change ask themselves the following question: who will the change affect and in what ways? How will the change be seen by those it will affect? And what are the concerns and issues of those affected? With any change, there will be those who resist the change, and the best way to overcome these resistors is to understand how they feel. Resistors often feel fear, loss of control, uncertainty, and a fear of more work. Once the concerns of resistors have been addressed, the strategies for change should be put in motion. Some strategies suggested are involving those likely to resist, avoiding surprises, moving slowly, starting small and flexible, and creating a positive environment. When issues arise, the response should be quick and positive. With so many options for healthcare, one may wonder why it is important to improve primary care. According to Dr. Mike Evans, who explores why quality primary care is so important, countries with better primary care have lower mortality rates. He also makes the point that having access to fancy machines and specialists is an important thing, but is not a good indicator of quality healthcare. Primary care is also important because it enables providers to get in front of healthcare issues and to prevent them. One way he mentions to make primary care better is by partnering in various ways, such as with researchers or other clinics. Partnering with competitors is often a foreign concept, especially in healthcare, but it can present many strengths. As we know from Goshi and Davis, partnering is working together for a mutual benefit. Clinics that are competitors can become partners. It can increase all the clinic's ability to provide the best quality of care. One network activity that clinics take part in that can be mutually beneficial is education and training. With the rapidly changing healthcare field and all the new advances it faces every day, it could be beneficial for competing clinics to share education and training resources. Another partnering activity that the competitors can benefit from is in the area of technology transfer. Technology in healthcare is almost as rapidly changing as the information and knowledge. By partnering with competitors, it can be an efficient way to stay on top of the many changes healthcare faces every day. One reason that mortality rates may be lower for those with better quality primary care is the better management of chronic illnesses. While there are many ways to improve chronic disease management, in an article from Von Chet, they suggest using a coherent, integrated approach to improvement. To do this, the providers should have an integrated approach to care with all staff members, working together for the health of the patient. The name of the program they use is called COMPASS Project and stands for Collective for Best Practices and Improvement in Healthcare and Family Services. The basis of the program is to have providers receive feedback so they can fix issues as they arise. The feedback is delivered in a face-to-face meeting. The research shows that the COMPASS plan was a successful way for providers to to improve the care they provide. With that being said, it is not the only successful program out there. When determining ways to improve primary care, it is a good idea to research multiple methods and choose what you feel is best, or combine methods to make a plan that best fits your facility. Improvements in primary care are one way to improve the overall quality of care in the whole spectrum of health care. As Medicare and Medicaid have shown with their pilot programs, improving primary care can also reduce costs. To save money, the whole health care system will face a large change. With like any change, there will be bumps in the road, but Goshi and Davis provide steps that can be taken to have a successful change in the environment and culture. In order to improve primary care and to get others on board for improvement programs, it is important to stress why primary care is so beneficial to patients. Another way that can improve the quality of health care is to partner with other providers to experience the many benefits partnerships have to offer. When implementing improvement plans, the key to success is to research the many different options of improvement and find the correct one for your facility. Thank you.